tongue condition and stroke. Hello, I am your healthy life, who protects your health. We always produce videos for your health management with information from Korean health management specialists and researchers in related fields. Is there anyone who hasn't subscribed yet? Please subscribe and like right now. Please share it with your loved ones. As a reference, the average life expectancy of Koreans is currently about 83 years old as of 2023, which is one of the longest average life expectancies in the world. I hope you all always watch our health management videos and maintain a healthy life. As you get older, you will experience various symptoms such as pain all over your body or blurred vision. Of course, there are cases where the cause is a decline in physical functions due to aging. However, certain abnormal symptoms can be signs of serious diseases. If you consider all abnormal physical symptoms as normal aging and ignore them, it is easy to discover them only after they have progressed to a serious illness. In this way, signs that your body is getting sick can also appear through your mouth. It is said that you can find out where your body is in trouble just by looking inside your mouth. In particular, if these changes appear in your mouth, it is said to be a sign of a stroke. A housewife living in Seoul said that she prevented the spread of cancer by finding this on her tongue early. Experts say that the elderly especially need to check if these symptoms appear on their tongues. I hope you will watch today's content until the end so that you do not miss the signs of health problems that are easy to overlook. If you have ever visited a local hospital, you have probably experienced this at least once. You went to the local hospital because you had a pain somewhere and the doctor told you to stick your tongue out and look inside your mouth. You may feel embarrassed because he suddenly said he wanted to look inside your mouth. In fact, there is another reason why he wants to look inside your mouth. The tongue is the place where blood vessels are distributed, next to the kidneys and liver. When your physical ability declines, symptoms first appear on the tongue. For this reason, you can find out if something is wrong with your body just by looking at your tongue. If you know what I'm going to tell you today, you will be able to check your own health condition, and your parents will be able to check for health problems by looking at other people's tongues. First, to check your health condition with your tongue, you need to look at the color and location of your tongue, etc. This is because if there is a problem with your oral health, the color of your tongue will change due to problems with the tongue mucosa and protrusions. First, let's look at the case where your tongue is pink. I stuck my tongue out and looked in the mirror, and my tongue color was pink, so congratulations. A healthy person's tongue is pink, has the right amount of moisture, is shiny, and has a thin coating, so it can be said to be healthy. However, there may be cases where the tongue color is abnormally red. In this case, you should suspect that you have a disease or inflammation in your body. Next, if you have severe white coating or your mouth is often dry. In this case, you should suspect oral dryness, which is a disease that literally causes your mouth to dry out. This causes saliva secretion to decrease, and the keratin on the tongue does not disappear, resulting in white coating. In severe cases of dryness, it can be difficult to chew and swallow food or speak. In addition, since the mouth is not properly protected from external substances, the risk of oral diseases increases. In cases where you have these symptoms, it can also be helpful to intentionally drink water frequently and eat fresh foods that stimulate saliva secretion. When you look at your tongue, you may see that it is newly or horizontally cracked. In this case, it is said that severe stress causes heat in the heart, which makes the mouth thirsty and causes the tongue to crack. If you see vertical lines in the middle of your tongue, you are likely to develop spinal disc or arthritis, so you should diligently manage your muscles and ligaments to become flexible. Next, if white coating is thick and cracks are visible in the deep part of the tongue, it is highly likely that the uterus and the cervix are not good. If you stick your tongue out, it may turn dark brown. If your tongue is dark brown like this, you should suspect glossitis. Glossitis is when the tongue's mucosas protrusions grow long like hair. While a normal tongue protrusion is 1 millimeter, in the case of glossitis, the protrusions can grow up to 1.5 centimeters. During this process, the tongue can turn black or white. One of the causes of this type of tongue twitching is smoking. This symptom can occur even if you don't smoke. This includes cases where you don't keep your area clean, take medication, or have vitamin deficiencies. If your tongue, which was not abnormal before, is tilted to one side when you stick it out, and if there is yellowish yellow on one side of your tongue, you should definitely get it checked out. This phenomenon can occur when a stroke occurs in the glottis nerve, which is responsible for pushing the tongue out from the brain, or in the hypoglossal nerve itself. It is said that if this symptom occurs, there is a possibility that a stroke has already occurred or has passed. Lastly, there is a case where there is a white spot on the tongue. In the case of a housewife in Seoul, Miss Park, she was brushing her teeth and was surprised when she looked inside her mouth without thinking. It was because there was a small white spot on her tongue. After that, for 3 months, whenever she ate spicy food near the spot, it hurt and stung. This housewife felt something was wrong and went to the dentist and was diagnosed with a type of oral cancer called tongue cancer. It is said that thanks to the early detection of the cancer, only part of her tongue was removed and she was able to regain her health. This type of oral cancer refers to cancer that develops inside the mouth, such as the tongue, gums, lips, and palate. Unlike cancers such as gingival cancer, it is not commonly heard of, so it may be considered a rare cancer, but the number of oral cancer patients is said to be increasing every year. Oral cancer is closely related to smoking and drinking, and according to the World Health Organization, WHO, and the International Agency for Research on Cancer, when the risk of oral cancer for a person who does not drink or smoke is 1, the risk for a person who only smokes is 2.1 times higher, and the risk for a person who only drinks alcohol is 1.2 to 2.8 times higher, and the risk for a person who both drinks and smokes is up to 15 times higher. 15 times, no, that is a huge difference. The 5-year survival rate for oral cancer is 82.1% if oral cancer is in the mouth, and 58.3% if it spreads to the lymph nodes in the neck. It is said that the 5-year survival rate drops to 24.4% if it metastasizes to the spleen or other organs. Therefore, it is recommended to quit smoking and drinking alcohol to prevent oral cancer. We have learned about health abnormalities that can be detected by the condition of the tongue. This information alone may be enough to detect major problems, but since there are many variables depending on each individual's health condition, it is recommended to receive a detailed examination for an accurate examination. That's all for today. Was today's content helpful? Don't forget to subscribe and like and set the notifications. Click the like button right now. If today's content was helpful, please share the video widely with those around you. Then, I will come back next time with more useful and informative content with advice from other Korean health management experts. Thank you for watching. Bye. In addition, the nerve-stabilizing effect of onions and the stress-relieving effect of vinegar work together to produce a great synergistic effect. This is the key point for today. Another recommendation is that onion wine is really good for the body because it is a miraculous way to absorb both the antioxidant components of onions, quercetin and myricetin. It does not dissolve, and no matter how much you consume, it is not well absorbed by the body and is often inactivated by intestinal bacteria. On the other hand, if you age it with alcohol, these components are directly released into the wine, maximizing the absorption rate in the body. In fact, according to a research paper published by Professor Huifeng Chiu of Taiwan, blood cholesterol levels were significantly improved after consuming onion wine for 10 weeks. Lastly, the third worst onion food for your health is fried onions. These days, you can eat onions as they are, fried nicely, and you can see a lot of fried onions at fast food restaurants. Even if onions are good for your health, if you eat them fried, they are definitely bad for your health. Since they are usually fried at high temperatures, they have a very high trans fat content compared to other foods. This is because consuming a lot of trans fat lowers your good cholesterol level and increases your bad cholesterol level. Also, if you coat onions in flour and fry them, a lot of sugar toxins are bound to be generated. These sugar toxins exist in our brain cells and cause inflammatory reactions. It is really dangerous to continue eating fried foods like this because it causes chronic inflammation throughout the body and further causes cardiovascular and brain diseases. To prevent cancer and dementia, you should avoid fried foods. So, what food should you eat onions with? Brown rice and whole grains are rich in iron and zinc. This zinc is very effective in strengthening the immune system when combined with the sulfur component in onions. Be sure to eat whole grains as well. It is good to eat with whole wheat bread and onion soup, and it is even better when eaten as a side dish with onions and multigrain rice. Finally, I will tell you some of the best tips for cooking onions healthily. First, if you lightly fry the onions in oil, the nutrients will be absorbed much better. It is recommended to use olive oil or canola oil that does not oxidize easily. Onions are good because when they come into contact with oxygen, the sulfur compounds, which are spicy ingredients, are converted into beneficial enzymes in the body. Remember that these enzymes are much more effective in promoting metabolism and preventing blood clots. So far, we have looked at the 3 worst and 3 best foods to eat with onions. Onions should be eaten with vinegar and wine, not honey. And do not use concentrated onion juice, but cook the onions with meat and chew them thoroughly. They are much more delicious when fried. How is that? I hope you all stay healthy by cooking and eating healthy foods using healthy onions and healthy foods. Thank you so much for being with us for a long time. If today's video was helpful, please subscribe and click like. Please share it with many people. I will always pray for your health and happiness. The next video will also be well made for you with good information from experts who provide health information in Korea. Thank you.